Hey guys, welcome back to Medical Coding with Blue. It is Answer Monday. Okay, so how do you think you guys did on this one? All right, I am going to continue to do these quizzes for evaluation and management because, like I said, we have so much to go over and there's just so much to do. It's not enough to have only 4 weeks of this, okay? So this was the last week for this one, technically. But like I said, I'm going to start incorporating them throughout the week. This Friday will start the psych quiz Fridays, so get ready. And I'm going to change the structure of how I'm setting it up, okay? So just get ready, all right? Now, I will start off with these exercises are not official. This is just me as a veteran medical coder sharing the things that I know. So let's go ahead and get started. All right, number 1. What are the 7 components for the descriptors for the levels of evaluation and management services? The answer: history, examination, medical decision-making, counseling, coordination of care, nature of presenting problem, and time. Okay. Number 2. What are the 3 reasons that a review of family history is so important? Answer: the health or cause of death of family members, specific diseases related to problems identified in the chief complaint, history of present illness and or systems review, and then diseases of family members that are possibly hereditary or put the patient at risk for this condition. Okay, so just something to keep in mind. All right. Number 3, what is the definition of a minimal problem? Answer: a problem that may not require the presence of a physician or other qualified healthcare professional, but service is provided under that physician or other qualified healthcare professional's supervision. Okay? All right, number 4, give 3 examples of a minimal problem: cold, insect bite, and tinea corporis. See, I did say it wrong before. It's corporis, all right? Number 5, name 3 diagnostic tests where fluid is obtained from a body cavity. The answer is lumbar puncture, thorcentesis, and culdocentesis. Hopefully I said that one right. All right, number 6, give 3 examples of acute, uncomplicated illness or injury. The answer: cystitis, allergic rhinitis, and a simple sprain. Okay. Number 7, define a self-limited or minor problem. Okay. Answer: a problem that runs a definite and prescribed course, is transient in nature, and is not likely to permanently alter health status or has a good prognosis with management/compliance. Okay. Number 8, what are the 8 social history elements that can be reviewed that can include significant information about the patient? All right. The answer: marital status and or living arrangements, current employment, occupational history, military history, use of drugs, alcohol, or tobacco, level of education, sexual history, or other relevant social factors. Okay. Number 9, what are the 7 past history elements that can be reviewed that can include significant information about the patient? The answer: prior major illnesses and injuries, operations, hospitalizations, current medications, allergies to food or medication, age-appropriate immunization status, age-appropriate feeding and dietary status. Okay, and number 10, what is the definition of a high-severity problem? The answer: a problem where the risk of morbidity without treatment is high to extreme. There is a moderate to high risk of mortality without treatment or high probability of severe, prolonged functional impairment. Okay? So I got all of these answers by using, or I got the questions, and of course I got the answers by using my CPT book, the Current Procedural Terminology book, and I also used my evaluation and management tool, okay? Now, the reason that I incorporated both is because I want you guys to start being able to really dig into these tools and to help you, so that way you can be more familiar. Yes, you don't have to memorize these things, but you should become aware of, well, what is a minimal problem? Then you should be able to say what a minimal problem is. And what is an example of a minimal problem? You should be able to give an example of a minimal problem. Sometimes people get caught up on the, what was it? What is an acute, uncomplicated illness or injury? People get caught up on that one. Same thing with the self-limited or minor problem. Self-limited or minor problem has created so many arguments just at my workplace alone. So I know that if it causes a lot of arguments where I am, there's a lot of places that it's causing an argument too. So it's very important to get yourself familiar and help yourself to understand and realize and recognize what each one of these things are, because this is going to be changing in 2021. Okay. Now, yes, we still have all these months till 2021, but the thing is, it's still really important for you to fully understand what's going on with all of these things. This is where your good foundation of knowledge is going to come into play. And when it, particularly with evaluation and management, because some people say that it's subjective. No. If you follow the rules, it is not subjective. If you follow the rules, it will guide you the correct way. Sometimes I can look at a record and I can see what the level is going to be. Then when I go through it, then I'm either correct, which most of the time I am correct, and then sometimes I'm not correct. Sometimes it's either higher or it's lower. So I still have to make sure that I'm going through the evaluation and management tool just to double check myself, because you will get to a point where you can look at a record and you can say, okay, I know it has this many points. I know it has this many points. I know it has this, this, and this. Okay, so it's going to be this. When you double check yourself, then you can see if you were correct or not. The more practice you have with these things, the better off you'll be. Now, Optum 360 has a lot of great books when it comes to evaluation and management. I'm going to be ordering some more. I'm excited. But one thing at a time, all right? When it comes to evaluation and management, study is really, really important, because you never want to be off. You want to have your level selections spot on. Now, if you find that if you are a student and it's just so overwhelming because it's just this little section in the book, right? And you're just looking at it, you're like, well, wait a minute, look and take the time to read it all, okay? And when you're done reading it, just go to like CMS, okay, cms.gov, and look in their Medicare Learning Network, okay? Look at what they have to say about evaluation and management. This is very important because, like I said, this will help you in your foundation to know and understand what is going on when you're looking at an encounter or whatever you're looking at. There are going to be times when a provider may want to have more credit, and they will tell you, well, this is going to be a level 4. If the documentation is not there, or if it is not complete in order to make a 4, you cannot go by just what the provider says if the documentation is not there. Now, always follow the rules. Just because somebody says that it's this, if the documentation is not supporting and you select the wrong code, it's going to come back on you. All right? So if a provider wants a higher level, but you see in their documentation that it's not meeting, then you need to work with your provider or talk to the person that's their job function, because in some places they have a clinical documentation improvement specialist that can help, or they have data quality people that can help with that. If that's their job function, then send it on to them. But if it is your function to help your provider and talk to them and things like that, then you really need to make sure that you prepare yourself before you go to them, and you get ready for you know, what they're going to come back with you at, you know, whatever and response they're going to come to you with. Sometimes they'll tell you, well, I don't have to do this, and that's the way we've always done it. Does not mean that that's correct. If they've always done it that way, then another fresh set of eyes looking at it, and especially where you can show where those holes in their documentation are in order to meet a certain level or whatever. If you can show, that's going to give you a good edge, because you have to be able to support your argument for a lower level or whatever the case may be. But if they want higher, then they need to make sure that they are documenting fully and completely so that they can reach that. Okay. I will do a specific video talking about coding based on time. This is another question that I get a lot of. Well, I spent all of this time with the patient. I need to get paid based on time. Okay, well, then we can talk about that, but it has to be documented in a particular way so that it can support what they've done and what they're going to do for this patient. Okay, so it's all about documentation and supporting the argument. Okay, so I'm going to go ahead and wrap this one up. But if you have any questions, let me know. Okay, I love evaluation and management coding. Is probably one of my most favorite parts of coding, next to coding, podiatry, and orthopedics. Anyway, let me know if you have any questions. Like I said, we will continue to do these. I'm just trying to think of how to set it up during the week so that you guys aren't getting so many. I want it to be structured enough that you guys are not, it's not like a bunch of different things coming at you all at one time. Okay, so if you have any questions, let me know. I am going to be breaking down the risk box, okay? So it is coming. Don't worry, it is coming. I will go ahead and wrap this one up. But let me know if you guys have any questions. I'll be leaving the answers down in the description box below, along with the link for last week's quiz Friday, particular one to this one. So, all right. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. Okay, I will see y'all on the next episode. Bye!